Ms. Smith, I'm Dr. Schoenfeld. What brings you in today?
I just woke up with this chest pain right here.
Okay, I noticed you were in the hospital about a week ago for 3 or 4 days for your gallbladder. How's it gone since then?
Well, it's been a little better, but I haven't been feeling really great. I've just sort of been, hanging out at the house, and I'm just not eating well. I just don't feel that great.
Okay. Tell me about this pain.
Well, a couple of days ago I noticed that I had some swelling and some pain in this leg right here, and then this morning I just woke up with this sharp pain right here, and I've also noticed that I've just gotten kind of short breath.
Okay. And I noticed looking through your record you've had no other history of any kind of blood clots or any kind of trouble with your breathing, no shortness of breath, anything like that. Is that correct?
That's right.
And no family members with any kind of blood clots?
Not that I know of.
Okay. I have here is a lady who was hospitalized recently who since discharge hasn't been very active, and she developed signs and symptoms of a DVT a couple of days ago, and then this morning had sharp chest pain. On physical, if you remember, her lung sounds are pretty normal. She was tachycardic on cardiac exam. Her saturation was 92% of room air. Like I said, her lungs were clear. Her leg did show some swelling and evidence of what I think is probably a DVT, and her labs were okay. So what do you think is going on with this lady?
I think she could have a pulmonary embolism, maybe.
And why do you think that?
It just seems like the way she presented, in my experience, it seems pretty similar to how they present.
Well, we're going to have to decide if we're going to order any tests to further work this up and see if she has a pulmonary embolism. We can't just kind of go on our clinical experience.
I definitely agree. We should order more tests.
So let's see what our student thinks before we do anything else. So I have a few questions for you that I'd like you to think about and report back to me when we're done. One, before ordering any tests, what do we need to determine if we need to do a test, and how do we decide which test to choose? Number two, what do you think is the role of testing in this patient? Do I want to rule in a pulmonary embolism, or am I trying to rule out a pulmonary embolism? And then based on the role of testing, what I'd like you to do is think about which kind of test that we're going to choose. Either is it going to be a sensitive test or a specific test?